Okay, so before going to the, I think, healthcare financing strategies, I'll show you a couple of slides that shows that how we are with regard to the spending of spending in healthcare. So you see the red line is the GDP per capita, and the green line is per capita total health expenditure. So you see the health expenditure is growing faster than the GDP. Is an account of health expenditure from 97 to 2007 is growing a bit faster. And but the total health expenditure is growing, is 3.4% according to the I think report of 2007. But the government spending in total health expenditure is almost remain same, is almost around 1%. So where is the money coming from? The additional expenditure is coming from out of pocket. So this slide shows the sources of money that is coming for health expenses. So you see the big chunk is coming from the household. So I am preempting some of your slides. Is it the same thing? Okay, I am moving to the health strategy. So I will tell you some lines, some sentences about the rationale. Why did we need a health strategy, a healthcare financing strategy, and the process, what process we followed to develop the strategy, and some of its content in terms of vision and goal, strategic objective, strategic interventions, population coverage, and sequencing of the implementation. So the rationale is obvious that our per capita total health expenditure is $16, and out of which 64% is being spent from out of pocket, and 15% population is facing the catastrophic impact of health expenditure. Healthcare budget as a whole, as a percentage, decreasing. It was earlier almost 7%, now it is around 5%. But although the total absolute amount of budget is increased, and it was mentioned during the last session that demographic and epidemiological transition is active, is going for more expensive healthcare, and we have different documents like health, population, nutrition, sector development program, 6 5-year plan, national health policy, and vision 2021. All the documents actually has a bearing, has a I think some sort of mandate to improve the healthcare financing. And for our healthcare financing strategy has a reference to all these documents. How we have developed the healthcare financing strategy? It has been developed through it was developed through a massive, consultative, extensive sharing method, and involving the people's representative, the civil society members, academics, NGO, and development partners. There are technical groups, working groups, disseminations at different levels, regional and central level, through which we got valuable inputs, and we accommodated all these things in this strategy. So our strategy is now probably it has been distributed, given it into the pack, so you can have a look into it. So its vision is to attain sustainable, equitable, effective, and efficient healthcare financing for a healthier population, and is aimed to strengthen the financial risk protection, extend health services and population coverage, with an aim of achieving universal health coverage. And the strategic objective we have included in this strategy, that basing upon the 3 areas that we saw the most difficult problems, that we have shortage of resources, we need to improve the equity situation, and also enhance the efficiency. So these 3 objectives actually are addressing the 3 major areas of difficulties. So we have included some interventions to address those strategic objectives. These are the design and implement of social health protection scheme, and under this scheme, I think we will determine the institutional arrangement for social health protection scheme, design and implement National Health Security Office, implement social Shastro Suraksha Karmosuchi for the below poverty level people, and design social health protection scheme for the formal and informal sector population. The other strategic intervention are strengthening financing and provision of public healthcare services. And under this intervention, there will be sub-interventions like implement need and performance-based allocation, scaling up and reinforcing of result-based financing like maternal health voucher scheme, retain user fees at the point of collection. The third is strategic intervention that has been included in this strategy is the strengthen national capacity, because we mentioned that one of the problem is the inefficiency in using these care resources. So these interventions will include the activities like support, information exchange, platform, knowledge hub, resource pool, like what we are doing today, just networking, partnering and pooling the resources what are around, and develop the capacity to design and manage social health protection scheme, strengthen financial management and accountability, improve monitoring and evaluation system, and also introduce mechanism to support the production of additional key staff. And these are nurses, paramedics, medical techniques, and today we have got that we need skills of health economics at different levels. So how this strategy is going to cover the whole population, as the universal health coverage is our target. So you see in the left column, the whole population is segmented in 3 groups. First one is the below poverty level, which is 31.5%, is around 48 million. They are poor. They will be covered by tax-funded, publicly financed healthcare, and some of the health protection scheme, which will be non-contributory, and government will give their premium, give the premium on their behalf. The second group, I think I should tell on about the last group, the formal group who has regular income and which I think constitutes 13.5% of the population. They have been in the formal sector, so they will be covered partly by the tax-funded, publicly financed healthcare with user fee retention, and social health protection scheme, and complementary private coverage. The middle one is the difficult one, because they are the informal sector and the biggest segment of the population. So they will be covered through formal and informal measures, I think different measures. These are tax-funded, publicly financed healthcare with user fee retention, community-based health insurance initiatives, micro health insurance, other innovative initiatives, and gradual move to social health protection coverage. You know, there are certain, I think, initiatives are being implemented in our country by different NGOs and philanthropic institutions, like micro insurance, social health, community-based health insurance. So we will be addressing this informal, biggest group of the population through these different measures. So this is the sequencing. So we start 2012, what we will be doing by 2016, because it will be the ending year of our present sector program, Health, Population, Nutrition Sector Development Program. By 2020, what we will be doing by 2024, 2028, and 2032 is the target, is a strategy of which spans over 20 years. And the universal coverage, that means everybody will be covered by 2032 is our target. So this target is being reflected in the bar chart. So in 2012, we are at this point, out of pocket is 64, and by 2032, out of pocket will be just half, 32%. So other interventions, other processes will be in place. So just to highlight why as I mentioned that why did we need this strategy, and now I have to reflect on what is the specific peculiarities or traits of this strategy. We can claim that it is explicit, since it proposes a path towards financial protection of health, for health with sequencing steps. So I mentioned these steps of by different years. And it's comprehensive. It proposes a framework encompassing all dimensions of health financing, It includes the tax-financed, contributive, community-based health insurance, micro health insurance, and other innovative scheme. Public, private, formal, informal, all sectors are included in this strategy, and it will cover poor, non-poor, all the whole population. But I should mention the limits, because it's not a panacea that one strategy will I think be cure everything in the health sector. So it has its limit. We know that health system has 6 building blocks, and health financing is one of it, and as such it does not cover the human resource issues and availability of medicine and provider payments. So this is all about the strategy. Thank you so much.